think about our employees' mental health and well-being, it's not an HR initiative. I mean, it's a business imperative. It's something that, all the way up to our CEO, who is obviously well versed in this, but she talks about it and she addresses it, and she's it's a point of discussion every chance we get. And when we do these town halls, it's always acknowledged, it's always talked about in a very matter-of-fact way, in a way that's hopefully done in a safe way where employees can get that feeling that it's not a secret conversation that may have been in the past, and it's something that I think that's modeled by the senior executives, it's modeled by Eduardo and the chiefs that make it part of a normal conversation.
So the first kind of wave of training, which we're still finishing up, is for all of our leadership, which is 4-person superintendent, and then all of our managerial staff are going through what's called QPR, which stands for Question, Persuade, and Refer. And that is at its core a suicide prevention training, but it also is meant to really be at any level of the mental health spectrum. So basically helping people be more empathetic and recognize the signs of potential distress at anywhere along the line, so that we hopefully avoid what Chad unfortunately had to experience ever again. And that's part of that suicide prevention partnership. That's the goal, is that to try to get that QPR in everyone in our industry, so that no matter where our workers go, because we do have a fairly migratory population where they work for different people at different times, the intent is that everyone will have that training no matter where they go.
The key thing for us with the resilience program and both Care for People is we were able to analyze those data longitudinally. So we looked at all of our resilience data. There was a clear trend in association with employee engagement and inclusion. And when we looked at our Care for People data, we had a Care for People survey. It was very clear through the data that we were able to demonstrate an impact. If you feel more cared for, you are more engaged in your work. It's a safer work environment. People are more productive. And we saw these metrics over and over again.
Prior to the pandemic, as we took a look at, basically a lot of the teachers with stress and anxiety type issues, and there's a lack of them going to see mental health providers. They're more going to a primary care provider and taking a pill for that instead of actually getting treatment and help on the whole situation. So we removed the mental health copay from office visits. So if you're in network, your mental health visits were free.
Referral system, so any service line can refer into behavioral health and get access if it's needed immediately, or suggestions if it can wait a week to 2 weeks before they need to see behavioral health. We have on-site physical therapists and chiropractors, and we have a fitness center with fitness representatives. There's, I think, 20 group classes offered a week, and they can be taken online or they can be taken in person.
Anyone who touches the construction industry has been part of this group called the Construction Suicide Prevention Partnership. That's in Portland, Oregon. And they've really been an excellent resource. I personally have headed up the training and education committee. So through that process and learning about what education content is available, we were able to identify one that would fit really well into kind of Anderson's training model, and that we thought we'd be able to deliver pretty easily for all of our supervisors. And so that has been a really great way for me to really understand what's all out there and what I thought might be the best or most effective for our teams.